Hello everyone. Welcome back to the channel. Today, let's talk about a common question many Ethiopian parents and grandparents ask. Should a newborn baby be exposed to the morning sun? The answer is yes, but it must be done safely. In Ethiopia, many families believe that morning sunlight is good for babies. Gentle morning sunlight may help the body produce vitamin D, which is important for healthy bones and normal growth. However, babies also need good nutrition and, in some cases, vitamin D supplements as recommended by a healthcare provider. If you decide to expose your baby to sunlight, choose the early morning, preferably before 9 a.m., when the sun is not too strong. Place the baby in a clean, comfortable place where soft sunlight reaches the skin. About 5 to 10 minutes is usually enough. Dress the baby lightly, protect the eyes from direct sunlight, and never leave the baby alone. These recommendations are the same for both baby boys and baby girls. There is no medical difference between them. One important point: do not rely on sunlight to treat newborn jaundice. If your baby's skin or the whites of the eyes become yellow, or if the baby feeds poorly, develops a fever, becomes unusually sleepy, or seems difficult to wake, take the baby to the nearest health center or hospital immediately. Some babies need medical treatment, such as phototherapy, which is different from ordinary sunlight. Remember, every newborn deserves safe, evidence-based care. If you are ever unsure, speak with your local health extension worker, nurse, midwife, or pediatrician. Thank you for watching. If this video was helpful, please like, share it with other parents, and subscribe for more trusted health information.